Okay.
Um, Good evening to everyone. Good morning, wherever you are. This is Osama Louish. Glad to have everyone here again. Thank you for attending our fourth out of five lectures. Today we're going to discuss stress or managing stress in the workplace. Our guest tonight is Dr. Jay Maddock, who is the co-director of the Center for Health and Nature. He's also the professor in the Department of Environmental and Occupational Health at Texas A&M University. His research has been featured in several international media outlets, including The Today Show, BBC, Le Monde, Eating Well, and Good Housekeeping. He has authored over 125 scientific articles and has served as a principal investigator on over 18 million in extramural funding. Hello, Dr. J. How are you?
I'm doing well.
I'm going to give the floor to you. Thank you for being part of this lecture series, and thank you to Serge Kuwait for hosting it. It's been a lovely time throughout, and I'm really excited for your talk.
Great. Thank you. I'm just going to go ahead and share my screen.
Yes.
And we'll jump right into this. So delighted to talk to everybody today about the topic of managing stress in the workplace. I think it's such an important thing for us to think about, especially given COVID time right now and just the stress, the additional stress that a lot of people are going through that we might not have had before. And so when we look at public health, we take everything from this Socio-Ecological Framework, which really lets us look not only at the individual, but also, where that individual is based. And so things like interpersonal, what are their relationships, their family, etc. The institutions that they work in, certainly the workplace is central to this, but that's also nestled within the community and within the broader social structure, policies, and systems. And so when we're going to try to intervene on an issue like stress, we can't just think of the person because that person is always within a context. And we use this graph from the CDC looking at how do we have the biggest impact, and really for something around stress, that changing the context, which is near the bottom, which is one of the most important factors, is where we want to spend a lot of time looking at interventions. You can do things, I'm a psychologist by training, and you can do the counseling and education, but that's a one by one model, and it's hard to really have that large population impact, where if we can change things to make the healthy decision the default decision, we have a lot more impact. So let's take a look now at a model of stress and stressors. And that's one of the biggest things to realize is we have a stressful event, right? This is what's called a stressor. So this could be a major exam, an important meeting, a financial setback, interpersonal conflict, a car accident, new life challenges, right? So those are stressors. Then you have the individual's personal appraisal. So this is their perception about the threat, which will be influenced by familiarity and knowledge about specific stressful events. And so what this is saying is that you can have two people in the exact same workplace, and you can have them go through the same event, and one person sees that as incredibly stressful, and another person sees it as just a challenge day to day. And so there's that psychology right there that's going on. If we do see it as a stressful event, we have a psychological response, which includes emotion, anxiety, anger, fear, frustration. We can see performance start depleting because we can't concentrate on what we need to concentrate on. And we can see coping efforts, help seeking, releasing of emotions, kind of these, how do we respond to this fight or flight response? And then physiological, our heart rate goes up, we start sweating, eyes blinking, some hormonal and neurochemical changes, and then eventually physical exhaustion. So a lot of things are happening in the body as we respond to stress. So if we're going to intervene, there's really three places that we can intervene on to affect stress in the workplace. One is we can work with the stressor itself, right? What's causing the stress? Two, we can work with the person's perception of stress. How do they feel this event is stressing or not? And three, which I think is really, really important, is our ability to respond to stress. Everybody's going to have a different capacity to respond to stress. And if we don't intervene there, we can really lose a lot of our ability. And then when we have stressful events, it really makes a bigger effect on our bodies. So the first thing that I think really to know is not all stress is bad, right? And so it's kind of this optimization of stress. where, if you're in a job and nothing is stressful at all, you're going to run into that boredom, right? It's like, oh, it's the same thing. I'm just doing the same thing every day. I'm not even interested in what I'm doing. And then you kind of hit that peak performance, which peak performance is saying, hey, there's a little bit of stress here, but it's good. It's good stress, right? This is getting me energized. I'm excited. My job is interesting. Things are different. But that can then easily go to the overstress, right? And overstress is like, it's just too much to handle, right? If I'm a physician and I'm seeing patients and I'm getting too many, like we saw with COVID, with just kind of the increase of number of people that we're seeing in the hospitals, that can lead to that overstress. And chronic stress then leads to the burnout and collapse. So once you get overstress, you can rectify it, but if that's happening day after day after day, it can lead to burnout and collapse. So understanding the difference between stress and burnout is really important. So stress is this characterized by overengagement. It's too much at once. Your emotions get really overactive. You can get, urgent, hyperactive. I got to take care of this. I got to take care of it. And that can lead to loss of energy. Or if you keep doing that, oh, geez, man, I'm getting tired. Can lead to anxiety disorders. And the primary damage really is physical, right? So with stress, with that fight or flight response, if we are not, actually using it because we need to run away from a predator, that builds up, that damages the heart. You're going to see the increase in blood pressure and the like. And so those are the physical damages. What happens then if we have this kind of continuous stress, that can lead to burnout. And burnout is really characterized by disengagement. So this is saying, I'm done. Like, I'm not interested anymore. I don't care about this job. I've lost my passion. Unfortunately, we see a lot of this in the healthcare field. You see both physicians and nurses dropping out of the field, just saying, you know what, I can't handle it anymore. The emotions are blunted. So you just, where you were caring so much and having so much of an action during the stress phase, it's kind of like, I don't care anymore. This is just, who cares what happens? I've had it. You can have helplessness and hopelessness. You lose motivation, can become depressed. And so the primary damage is emotional. So really, the difference between stress, which is that immediate, I've got to take care of this is a big problem, to burnout is, I'm done. Burnout is really that switch to saying, I've had it, I can't cope with this anymore. So we're going to look first at controlling the stressor, right? And so this is from a workplace setting, right? And so how do we control stuff in the workplace? So there's this job strain or demand control model. And it really just says that job strain occurs when job demands are high and job control is low. And so the two questions we ask people is, do you have enough time to get everything done? And how much can you choose about how you spend your time, right? So what's the demand and what's my control? And so as a professor, it's one of the most wonderful jobs in the world because I get to choose how I spend the vast majority of my time every week. So that makes the stress a lot lower. But you can think even in a physician, which is a high prestige job, how you spend your time is controlled by the patients that come in, by your hospital. And so a lot of times that's why we see stress and burnout in healthcare workers, because that control of time is low. And, certainly here in the US, our physicians might have 5 or 6 minutes to see patients. And so that over level of working and just stress is really high. And so we tend to see a high job strain on the healthcare workforce. Kind of the original study that looked at this was the Whitehall studies. And so Sir Michael Marmot did this in the UK back in the 80s. And he took 10,000 and, it is the 80s. So it was male civil servants. And obviously we don't have it, we're gender controlled now, but looked at them over 10 years and divided it into 4 groups. So the administrative were the highest level of groups. These were permanent secretaries, deputy ministers. The people below them were the professional and executives, so senior executive officers, clerical, and then the bottom category were these unskilled manual workers, porters, messengers, kind of what we call blue-collar jobs. And what he looked here is he went over the course of look at the relative risk. And so top officials, obviously, is where we set the regression at. So at 1.0, you can see that there's an increase in executive, an increase in clerical, and an increase in blue collar. And so really this linear trend to relative death rate. And even after adjusting for other risk factors, there's a pretty strong increase. And so what he found is actually, if we look at this original papers from the Whitehall study, is you see this increase in death. And what's interesting is it's the unexplained risk factors that really are accounting for a lot of that increase in death. So you've controlled for blood pressure, for smoking, cholesterol, some other dietary habits, etc., and you're getting this large bit unexplained. And so what they pretty much said is, look, this seems to be the control that you have over your job. It's not that administrative jobs aren't stressful and don't have a lot of work, but those administrators choose what they're going to do, how they're going to do it, etc., where a blue collar worker is being told exactly what to do every day. And this seems to lead to chronic stress and early death. Newer study looking in 2002 at job insecurity and health in women. This is really, do you have a stable job? Right? Are you going to get laid off? Are you going to, you just kind of doing piecemeal work? Or is it something where, you got really good job security? And you can see here that the ill health goes way up, both in physical and mental and depression. Long-standing illness is a little more mixed, but certainly that poor mental health has a huge increase. And so not knowing if you're going to have a job or if the job's going to be stable is a huge risk factor in this study. In this one, they looked at job strain and coronary heart disease. So this is a meta-analysis, and you can see, once in a while there's some inconsistent results, but really the overall effect shows that there is a significant effect of these studies that say you're more likely to have coronary heart disease if you are having a lot of job strain. So what can we do at that workplace level? Number one is really provide more stable jobs, and really, when we can, providing ability to say, you've got your job, you don't need to worry about getting fired, laid off, etc. And certainly in the last year, I think globally with COVID and recessions, a lot of people have lost their job. We've seen unemployment go up dramatically, and so that category, we're going to expect to see a lot of additional heart disease from that just happening last year. Making sure the workload's not overwhelming, and really looking at how much work are we giving people, and do we check in with the people that work for us and make sure that they're not getting overwhelmed, and then providing control wherever possible. So one of the interesting things here is we saw huge COVID outbreaks in our meat processing plants, and what they do is we had a study go in and say, where are they spreading COVID? And what was interesting is it wasn't on the line, it was in the break room. And every single employee got the exact same break, and they all had to go into the same break room and eat their lunch. And because they would just stop the line, right? So instead of staggering shifts, maybe slowing it down, they told you exactly when you could go, when you had to sit, when you could eat, and that ended up spreading COVID. But it also showed that, in this workplace, control was really, really low. When you're working on a factory line and you're told when you can go to the bathroom, when you can eat, that's one of the least controlled situations that you can have. And you can certainly imagine that the stress is high in that situation. Okay. So turning over to, I think one of the biggest topics then is we can affect the stressor, but dealing with the stress is really important. So how do people actually manage and perceive the stress? And so you have something, like a tiger, some situation in the environment that's stressful for you, right? And then you perceive that as stressful or threatening. And then your body has this physiological and emotional response to the stressor, right? And so the first thing we look at is kind of these maladaptive responses to stress. So we have to reduce that stress and that kind of feeling of anxiety in some way. And so what we've seen, really across the globe, but certainly the most in the United States, is the rates of obesity have gone up dramatically. And this has contributed both to poor diets. And so the idea of stressful eating. People are saying, gosh, I'm stressed out. Maybe if I eat, comfort food or fast food meal, that's going to help reduce the stress. They're also not getting exercise, which is a positive way to deal with stress. And so we've seen this really dramatic climb in obesity over the last couple of decades. What we're also seeing is another maladaptive way of stress is that everybody's on their phone now, right? And so just the amount of time people spend in major media. Here's the US in 2012, people were spending 11.5 hours a day on a variety of media. And by 2018, that was up to over 12 hours a day. So a 30-minute increase in a 6-year time frame is really, really dramatic. But what's interesting is if you look at where that occurred, it occurred on our cell phones. So the cell phones went from an hour and 28 a day to 3 hours and 23 minutes. And so people really in these phones and I think looking a lot for stress relief, right? I'm just going to look, I'm going to, be on social media, or I'm going to look at YouTube, or I'm going to do something else to just try to distract myself from the stressful environment that I'm in. So there's definitely another kind of maladaptive coping mechanism for stress. Certainly cigarettes, smoking is a way that most people say, why do you smoke? They say, well, I'm dealing with my stress, right? And if you're a non-smoker, you have stress, you figure out a positive way to deal with that stress, and you're feeling a lot better. With smoking, you have stress, and then you have nicotine, and it can make you feel better. But if you didn't change the stress or the stressor, it's still there. So really, the smoking doesn't do anything. It's just a temporary relief, and obviously has major long-term health consequences. The other one in the U.S., of course, is alcohol use. And, really another maladaptive way is that, people think alcohol reduces stress. It doesn't. They think it helps you sleep. It actually, interrupts your REM sleep and your deep sleep. It leads to stress and weight gain. And so people gain weight. And so really, it's a really maladaptive strategy for dealing with stress. The other really interesting thing that we've seen in the US, and I think this is related to the instability of a lot of the jobs that we're talking about, is we're seeing this deaths of despair in our lower educated white population, right? And so this is deaths of despair, alcohol, drugs, and suicide in kind of middle age. And so we've seen the opioid epidemic here in the US, where kind of opioids have taken over and people have been just taking them to kind of get their brains away from stuff. We've seen a lot of the drop in our middle class jobs here. And so a lot of people that might have went to work at Ford Motor Company or something and made a good middle income salary, those jobs are gone. And so a lot of the people now are in the service industry. So they're in retail, they're in fast food, etc. And those jobs tend not to have good benefits. And so we're seeing the stress go way up. And then people are dying in their early 50s, which is really, really young for people to be dying. We also see anger, right? This is another way that we see stress. And certainly in cities where we have a lot of traffic, the road rage is an issue. But just anger in any way, it's a maladaptive response to stress. Because you can't control your workplace, so you get angry, and then you take it out either on the person in front of you on the highway or your family with domestic violence. So another really maladaptive way. So the question, okay, there's all these poor ways that people deal with stress. What's the positive way? How can we actually deal with stress in a much more positive way? So the first thing that we look at is cognitive reframing. And so this is thinking about stress as a challenge or an opportunity to grow. And so if public speaking is typically a stress, reframe it as doing something you can get better at. So they actually took a study, and they had a bunch of people, and a lot of people say that public speaking is the thing they fear the most. And so they brought them in and said, okay, instead of thinking about this as a stressful event, think about it as, hey, this is going to help you get a lot better. And when next time you do public speaking, you're going to be a lot better at it. And by cognitively reframing or thinking about it in a different way, they saw that people's stress levels really dropped. And so, it's an interesting way, is if we can take that and anything that we see as a stressor. Remember, a stressor is just an event that happens. It's the way that we deal with it that's really the important thing. And so cognitive reframing is one of the biggest things that we do, is think about what's stressing you out, and let's see if we can think about that in a different manner. If that doesn't work, there's other ways to deal with it. So mindfulness, meditating, really thinking about where you are and what's happening, and really taking just even a minute or two to really just do some deep breathing and realize where you are. And so you can say, life presents a schedule that's too busy, high pressure to perform, too much media, lack of face-to-face relationships, increased anxiety and depression, and this fight or flight response that we're in. And obviously that leads to a lot of negative effects. where if we work on mindfulness, and they've done these studies, they've done the brain scans and really been able to show that you see this increased stimulation in the prefrontal cortex, you can have better focus and concentration, compassion, increased sense of calm, and understanding of how our brain works. And so, we've done some of these breathing techniques with just people. One of the main things of stress is it's too much work, right? So just take that moment, take a few deep breaths, realize, it's not the end of the world. Things are going to get done. There's always tomorrow. And if people practice these techniques over time, you really do see these changes. And then people are able to handle the exact same work environment, but in a lot better way. Another big factor is helping relationships. And this is, do you have somebody that you can talk to? And, having someone that you can just tell your problems to is big, even if they don't actually do anything besides listen to you. It really makes a big difference. And this is, again, something that we've been really working on during COVID. For a lot of people that live alone and stuff during lockdown here in the US, it was really hard on a lot of people because they didn't have somebody they could talk to. So figuring out ways that they can talk, we did a lot in our workplace wellness effort called Flourish to connect people, just to have people to talk to, because that can make a huge difference in the way that you respond to stress over time. I'm going to talk a little bit about some of the work that I do with Center for Health and Nature, because I think this is such a important way. And Osama was telling me that some of the access to nature might be limited in Kuwait, but there's ways that we can look and design that. And so it goes to some work by E.O. Wilson looking at this biophilia hypothesis, which really just says that there's an innate emotional affiliation of human beings to other living organisms. And really what that says is we're meant to be in nature, right? We're meant to have this connection to natural environments. And when we take that away, it really causes stress. So with my work, what we look at is the spectrum of nature contact. And you can have the frequency and the spatial scale. And so, that wilderness adventures that's up there in the left corner, that's something that maybe, once a year or something, we get out for a long weekend in a natural environment, and that resets a lot of the work that we do and actually affects our killer T cells and really can have a long-lasting effect, all the way down to things like window views of nature or potted plants or nature-based education. Some of these, what we call everyday nature, can be really important. And so we're even doing studies in Houston Methodist, our hospital, where we're changing the exam room to either incorporate nature with plants and the like or not. And that seems to be making a difference in people's level of stress and anxiety when they're seeing the physician. So a lot of this work started, this guy, Robert Ulrich, was a faculty here at Texas A&M, and he co-founded the Center for Health System and Design, which I'm a member of the executive board on. And he did this pioneering work between looking at hospital design and nature access, and really saying, can we design our hospitals in a way that promotes health rather than retracting from it? And so his initial study in 1984 said that this is the simplest study. They had, 2 sets of hospital rooms. One of them had a window that looked into trees and grass and kind of this pretty nature scene. The other one looked into the parking lot. And he looked at the rooms and they coded them either as having a nature view or not. And those that did recovered faster, had less time in the hospital, used less painkillers, and less post-op complications. And so really this amazing difference just by having a view of nature out your window, which is such a simple thing, for us to do. And that work's been continuing on. They looked at the effect of exposure to daylight on patients. And so patients experience less pain, stress, use of pain medication than patients that didn't have natural light in their room. We put in a hospital garden at Methodist right now, and seeing that seems to alleviate both patients and their families. We're doing a lot of work with kind of hands-on gardening while people are recovering in the hospital. And then looking at the facility design and showing again that natural environment has a positive rate on pain, stress, anxiety, blood pressure, and heart rate. And so, from a workplace thing, obviously, if you're working in a healthcare facility, we can do this for the patients, but it's just as good for everybody that's working there also, right? So that ability to really take the setting in a hospital and say, how do we green the space that we have? And it doesn't need to be super expensive. It doesn't need to be a total redo, but it can really be incorporating nature into everyday life. So we work a lot with landscape architects who are able to kind of look at a facility and say, how do we bring in green space into an already built facility? Now, the problem that we have here in the US is we've looked at American adults spending too little time outside each week. And so you can see from this graph that it's almost 80% of Americans spend less than 10 hours outside a week, right? And so that's, just a little over an hour a day, and it's very few people that spend that time outside. And so we're trying to look and say, how do we shift that to try to get people out in, and that doesn't even mean out in nature, that's just outside. And so even getting them into more green spaces, because it's been a real big problem is people don't value and don't realize how important it is to be in natural environments. And we see from the study, so they took the study, brought a bunch of people living in a city and just brought them out to, a nature setting for a long weekend. And when they came back, they found they had less mental fatigue, less irritability and accidents, increased problem solving, and increased attention. And so you can think about all the things we talked about with stress, right? Mental fatigue, irritability, problems with concentration. Pretty much you can fix the stress issue by sending people into a natural environment over a weekend. If we look at physical activity, and we know physical activity is obviously another important way to look at stress. A study showed that people who exercise in wooded environments had a lower risk, and that's about half, right, an odds ratio of 0.55, of lower mental health than those who exercise in non-natural environments. So just taking a walk in a park was much more important than going to the gym. And, we've really been working, because so many gyms are closed now because of COVID, we've been telling people, go take your exercise outside. And walking in nature can improve directed attention abilities. This is interesting. It's actually looking at studies of just taking a short walk in a green space during the day seems to reset your ability to pay attention to stuff. So if you think about stress and getting overwhelmed, that short walk during the day can really set you up to be more successful in the afternoon and help reduce your stress. And this is really going over a lot of different places, really big in the UK, where they can prescribe nature in Scotland. And the UK doing this 30-day wild. In Japan, it's called forest bathing. And so this is in Korea. So they're sending a lot of people out and giving them prescriptions to spend time in nature. We work with ParkRx America, so our physicians can actually prescribe outdoor space to their patients. And so really, it's a growing area of evidence, but the work that every study that we've done shows that there is this relationship to spending time in green space and health outcomes. All right, and the last part, we're going to just switch and just talk a little bit about our ability to respond to stress. So we have the stressor, and if we're not, running the workplace, that can be kind of constant. So then we have our, perception and our ability, or our, how we look and perceive the stress. And then the last is really our reserves. And this is so much as, how healthy are we? Are we able to deal with stress? And, first off is sleep. Adults need somewhere between 7 to 9 hours of sleep a night. And when we don't get enough sleep, it really is affecting all parts of our body. And this is our capacity to respond to stress. So if you're stressed out and you're not getting enough sleep, it's just going to keep this cycle of not being able to respond because you're not recharging yourself overnight. And that's especially seen in shift work, right? So for people that work, you might be in the hospital. If you're on the overnight shift, it really can be hard for people to get good sleep rhythms. We are increasing the amount of physical activity that adults get in the U.S., but we're still a long way away. So only 24% of American adults get enough physical activity. In cities, this went from 19 to 25% between 2008 and 2017. In rural areas, from 13 to 20. So we still have a long way to go. And that's just the 150 minutes a week of exercise plus 2 days of muscle strengthening. And then the other thing that we've seen, with the rapid urbanization around the globe, is that this might be what a day looks like in the U.S., right? People get up at 6, get ready for work, drive to school or work, sit in traffic for an hour, work from 8 to 4:30, drive home for an hour. They remember their physical activity recommendations. They take a brisk walk in the evening, have dinner, watch television, or play on screens, and then go to sleep at 10. And so the question is that active or sedentary? They're actually meeting their physical activity guidelines, but at the same time, they're sedentary for 23 and a half hours of the day. And so what's changed, interestingly, in the physical activity research in the last decade, maybe decade and a half, is this idea of the exercise physiology curve, right? And so everywhere from sleep and sedentary to light activity to moderate to intense. And so if you think about physical activity research in the 80s, it was all about high intensity physical activity, right? So we're going to be jogging, running marathons and the like, or we're going to be athletes. And then kind of when the physical activity recommendations came out in 1996, it moved a lot more to this moderate physical activity. So walk 30 minutes a day, get light activity every day. And now we're realizing, hey, you know what? There's a big important piece here on sedentary to move it to light, because you can only do so much intense and moderate per day. But can we move people from that sedentary behavior, like sitting, to light activity? And that we can do for many more hours a day, and seems to have a separate physiological response outside of the moderate physical activity. We have a huge problem with people driving in the US. Here in Texas, if we look at our trips per day, 91% of them are in our car or truck. Only 6% are public transit, and then 1% walking and biking. So the vast majority of how we do our errands or get to work or get the kids to school are driving. And so another huge source of sedentary time. And we know if we can even shift a couple of those trips to be active trips, that can build a lot of additional physical activity in people's day. We do research here at the School of Public Health looking at standing desks. And so standing desks are another way that you can change your physiology, right? So moving from that sedentary to light activity. And we actually just completed a study looking at call center workers. And we found that they had a 46% increase in the number of calls that they completed when they used these stand preferred desks versus seated desks. And so another way that we can build in light activity, and we can improve our ability to cope with stressors. You can also do walking meetings, right? So another way that you can improve workplace health, not just on the exercise side, but again, this is if you're walking and you can walk in a space that's green, you can really make a difference. And I didn't include in this talk, but someone was reminding me how hot it is in Kuwait. And so we actually work with a faculty member in the College of Architecture who looks at microclimates. And so his expertise is all on how do we make spaces cooler. And so, of course, that's important here in Texas, but it sounds like it'd be really important in Kuwait. And so there are architects that can look at space and say, let's see how we design this. And maybe we can, either through the airflow or through the shade, we can actually make the space be cooler and be more comfortable to walk in, certainly as you guys are getting into the hot season now. Diet is another one that's huge. This is the percentage of Americans by state who eat enough fruit per day. And vegetables look the same. Less than 18% of Americans, the median's around 15%, even lower. So Americans don't eat enough fruits and vegetables. We really have a hard time getting them to do that. And again, healthy diet is allowing us to respond so that we're not getting obese, and we have a better capacity to respond to stressors in the environment. And so this is a program that we launched with my work in Hawaii, where it was before I came to Texas. And it's called Choose Healthy Now. And so we went through cafeterias and mini marts and even the vending machine and really looked at what was being offered and if we could change that or not. So can we actually move and promote healthier foods that are going to promote health and well-being and our ability to respond to stress rather than fried food. So we took the fryers out of all these places, and you can't get French fries anymore, but people are a lot healthier. And so, as we build the environment, it's really important for us to not make mistakes. And this is amazing. This is a bike lane with a big tree in the middle of it. Is that we need to make sure that we're doing health promoting environments that support the health of our workers and really are buffeting stress and not increasing it. And so really the major take homes for today, there's three things we can do, right? We can try to reduce the source of the stress, the stressors, right? We can look at our control in the workplace. We can look at how much work people have to do. and look at the stability of people's jobs. And that's a way we can try to buffer the stressors. But there's always going to be stress. No matter what we do, there'll always be stress. So then we have to change how we deal. We can do cognitive restructuring. We can make sure we're not doing the negative ways to cope with stress. And then we can improve our ability to respond to stress by staying healthy, by exercising, eating well, sleeping, and really being able to have that reserve so that we can respond to what we have to do. So that is the end of my talk. Thank you very much for your attention today. And I think I'll turn it over to Osama for some questions, and I'll stop sharing
here. Thank you, Jay. That was a really nice talk. Really, very beneficial stuff. I think between everyone attending today, we all share a big amount of stress, especially in the workplace, and especially with the times we're going through. I have some questions here in the Q&A. I'll just tell everyone, if anyone has any questions, to just add them to the Q&A section in the bottom. So the first one we have is, how can we deal with workplace bullying?
Yeah, that's an interesting question. What we've come to at Texas A&M is really not tolerating it and just saying, you know what, we have to have a culture of see something, say something is what our program is called. And so if we do see anybody bullying, we make sure that it's, we talk to them, and we also report it up to their supervisor. And just a culture of zero tolerance for that has been really important. We see it a lot with professors and their graduate students, because the grad students a lot of times feel like they have no power. And so, when I was serving as dean, that was a lot of people would come and say, hey, this is not happening. And we pretty much told them, hey, I don't care how important, how famous you are, you can't bully your employees. And so that zero tolerance, I think, was really important for that.
Yeah, thank you for that. I just want to just share everyone that we've added the link for next week's talk in the chat, just in case anyone's leaving before the end of the questions. You can sign up for next week's. It's going to be about nutrition. Sorry, Jay, I just had to get it out there. Another question we have is, can you please elaborate about the Flourish program you guys did for COVID?
Yeah. So I started Flourish here at Texas A&M, and what it was is it's a workplace well-being and engagement program. And the idea was really, so many wellness programs fail because they're all fitness programs or healthy eating, and especially trying to get guys involved in that is really, really hard. And so what we said is, let's build a program about connecting people, making friends, having fun. And so we started this program. It was last January. And then, of course, as COVID hit in March, we had to say, how do we take this now and make it virtual? And so we've done a lot of things, even like book clubs. So we do a book club, we do game night where we play games on Zoom to really create friendships. And so it's been, if you've got a best friend in the workplace, it's actually one of the biggest indicators from Gallup on people being happy and healthy at work. And so that's a lot of what we've done in Flourish, is just connecting folks together and getting them to enjoy, where they work and the people that are around.
Nice. Next question. Can you please elaborate on you spoke about the idea of prescribing outdoor time. How does that actually work? Is there specific areas where they go, or is it?
Yeah. So, the easiest thing to do, if you go to ParkRx, you'll find their website, and there's actually a toolkit on how to do it. But pretty much what we do is the physician has a prescription pad that they can actually write out a prescription to walk 3 times a week in nature. And then we have a set of maps and places that people can go and exercise in their neighborhood. So this is in Houston. And so we have the different Houston neighborhoods mapped out depending where people live and kind of what they're looking for, and walking routes and the like. And so, but great set of tools and toolbox on ParkRx.
That's nice. Yeah, definitely. That's something I'm going to visit myself. Next question. Can you please elaborate and give us some examples about how the architect has helped create cooler spaces? It's something we could definitely benefit from here in Kuwait. So can you think of any of the stuff they've done?
So it's really interesting. This guy, his name is Robert Brown, and he is like the world leading expert on microclimates. And so they actually brought him out when they were planning on doing the Tokyo Olympics. And they brought him out to Tokyo to go through the marathon trail. and look at where, the different microclimates of the space. And he actually rerouted the entire marathon because of his advice, because they looked and said, okay, it's too hot here. And so what they looked at, things like airflow, right, is how does the air flow through buildings? And so they can design the buildings to maximize the cooling air and not block it. And then shade structures, certainly. There's a variety of different ways you can do shade. And then greening up spaces is interesting. So when you have trees, everyone says, oh, it's cooler because you have you've got shade. And that's part of it, but it's actually the evaporation that you get that actually makes the space even cooler. And so greening up those spaces. And so, his name is Robert Brown, and I can send you an article or two.
Yeah, I'd like that.
Specific stuff, sure.
Yeah. Perfect. Thank you so much. Next question is, how would one manage the stress in surgery for surgeons and fellows? Any advice on that?
I do not work in a hospital, so that's a little trickier one. But I think the idea again is you've got to say, okay, you're going to have stressful work, right? And surgery is obviously very stressful. But having that cognitive reframing, I think, is important. Making sure people have enough time. If they're thinking of it as a challenge and something they can build upon, and if you're not, kind of in this lose situation if the surgery doesn't go perfect, I think is also a way to reduce stress, right? You can't, if people are doing their best and doing their work, you can't really hold them, and say, this is, you're going to lose your job or something like that if you don't do well. But I haven't worked in a surgery, so I can't do too much specific on that one.
Oh, thank you for that. Next question is, I'm working in a psychiatric clinic. I listen to sad stories every day, and reframing is a great way to deal with stress. But sometimes I find myself exhausted and unable to listen actively to my patients. Any advice on that end?
Yeah, I'm a psychologist, and so I definitely have done that. And I think the reframing is good, and I think making sure you're taking the time for yourself. And so looking at your schedule and saying, is there something I can build in during the day where I'm taking a walk, maybe in a green space, and just getting my thoughts together. Mindfulness, I think, is a great way to even just spend a minute or two between patients, having that deep breath and the like, and then all the things in terms of just resetting yourself and taking care of yourself, so you can respond and that you're not overwhelmed with that, because it can be very draining dealing with people and just the difficulties that they have.
Perfect. Thank you for that one. The next question is, how does one manage stress for leaving their 1-year-old child back when they have to go back to work?
Yeah, I have 2 kids, and I definitely went through that, and it's a challenge. I think but it's we always said let's reframe this and let's really think about the opportunities that a kid has. I mean, the biggest thing with your child is you want them to be successful in the world, and even at a young age, that socialization and starting to just learn and explore the world outside of you lets them realize that, hey, there's different worlds from just my parents. And so if you think about it in a positive way, I think it can really be a gain. And it's hard. It for sure is hard, but that is what we want our kids to do, is to thrive and to learn to live for themselves in the world.
Yeah. Thank you for that one. This question, I'm going to try to reword it to understand it better. It says, the repetitive stress could generate a health worker as a disruptive person. So I'm guessing it's maybe ways to, work or manage repetitive stress, because it's kind of affecting the healthcare workers and making them feel as if they're disruptive persons.
Yeah. Okay. Let me think how I want to answer that. Is repetitive stress healthcare workers a disruptive person? I don't understand exactly what.
Maybe another way to look at it is maybe the stress caused by disruptive people. Maybe
yes, yeah, that for sure. And that is, a lot of our stress does come from people that are disruptive in environments, and things aren't going the way that we want. And so I think that cognitive reframing is so important. And so we have something called the fundamental attribution error, and that says that when somebody's a jerk to us, we tend to think it's a state, right? They're a jerk, right? But when we do something that's maybe not the nicest to other people, we know why, right? We were busy, we were, stressed out, we were, so we think about states for us and traits for other people. And so I think realizing when somebody comes in and they're disruptive, they're in the healthcare setting, they're upset, and so thinking, say, you know what, they're having a bad day, and we can deal with that. It can be a much easier way than really, oh, I hate this person. That's a maladaptive way to deal with it.
Yeah, thank you for that one. They're saying there's a thin line between maintaining maximal output and burnout. How can you avoid the negative outcomes of burnout?
Yeah, I think that's a great question, because I think I saw that graph that I put up, and there is no definitive line. I think the biggest thing is to check in with yourself. Um, Part of the mindfulness can kind of be, how do I feel? How do I feel like it's too much? And when you start to feel that too much, you got to take your foot off the accelerator, right, and sort of take a step back and say, make sure I'm taking care of myself, and then I'm thinking about it. Because if it does get too much, you need a break. And I think having people in your workplace that you can talk to, that you can say, hey, look, it's getting to be the point where I can't handle everything, and I need to be able to step back a little on this.
Yeah. Thank you for that one. We have another question saying, in a multinational company, as a Kuwaiti mother, I feel sometimes overwhelmed with single expats working around the clock and even during off hours. How would one manage this in a competitive environment?
It's a very interesting question. And so, when I was the boss, I was the dean of the school here, I put a policy in that I didn't do any emailing after hours or on the weekend. So I'd still work because but I would hold everything, so it would send everything on Monday morning. So people wouldn't get emails from me in the off hours. And so we actually created a policy across several of the colleges at Texas A&M, because we knew, like, if I emailed my assistant at 9 o'clock at night, she felt like, I've got to get back to you at 9 o'clock at night. And so by setting that down, where we said, we're still going to work, but we're going to make sure that there's not that expectation of people, because working around the clock is terrible. And, and the other thing I think is really important is, if we do not take care of ourselves and we do not recharge ourselves, we're not going to be as productive. And so the idea that we talked a lot about is, let's be as productive as possible during working hours, and not work when we leave the office. And so really shutting that off, I think, was important. And just that it's a culture switch, though. I mean, so it's hard as an individual, but certainly it's a conversation that you can start having with people and saying, hey, we need to take care of ourselves, because then we're going to be at our best and do our best work.
Oh, yeah. Good one. I have another question for you, just to elaborate on this one. How would that be with COVID? I mean, now with like people working from home and stuff, do you think there should be some barriers in terms of what to expect from your staff and all that? Even
Yeah.
I mean, some companies think they're kind of doing you a favor of like letting you stay home or whatever, although it's a pandemic out there. Do you have any recommendations on how to manage that and how to respond to that kind of remarks or stuff like that?
Yeah, it's interesting, because I noticed this, because we shut down the university between March and August. I was working from home exclusively. And the biggest thing that I noticed is it started to flow into my day. And I started to say, gosh, I'm not turning off my computer at the end of the day. And my computer, every time an email comes in, it dings. And I'm like, this is the worst thing I could possibly do. So I really got to say, okay, these are my working hours, and they're going to be the same as they are when I'm in the office. And the people that work for me, I said, tell me what your working hours are. I'm fine if you need to be flexible because your kids are home or whatever, but let's agree that these are the on hours and these are the off hours. And we're not going to schedule meetings in the off hours. We're not going to expect responses to emails, so that you don't become this 24/7. Because I think that is the risk of working from home, is that your computer's there and your workstation's there, so you can always be on.
Yeah, that's true. I know, to elaborate on the last question, I know in France, I think they've made it, against the law to kind of send out outside of working hours.
Oh, well.
Yeah,
We'll
I
never do
think I
that.
read something about that. Something about having a policy with out of work hour emails and stuff.
Yeah.
Another question I have here is there a deep relationship between stress and depression?
Yes, in that there's a really deep relationship between burnout and depression. So stress, you tend not to get depressed because you're in that kind of excited state. But when that moves into burnout and the chronic area, then people do have a huge amount of depression. So that, as we talked about, kind of that switch from the physical damage with stress to the mental health damage with burnout.
Oh, perfect. Next question. If someone is having a deadline tomorrow and is totally exhausted a day before, how can one avoid burnout?
It might be a little bit late at that point. I mean, that's unfortunately, it's, when we have to get our work done, we have to get our work done. And I think, getting through that one is probably good. And then, I think letting your supervisor know, like, hey, I need a little bit of time off after this. is important to recharge. And so certainly when we have big grant deadlines, we are working like tons of hours and everything else, but then we always make sure that we schedule in a day or two off. And so that we take that time afterwards and just say, what, I need to refresh and recharge myself. And so deadlines aren't going to go away, but I think people know that, if you're up till 11 o'clock meeting a deadline, they don't expect you in the office at 8 o'clock the next morning. And just having that, kind of a more, a balanced approach when you do have deadlines.
Perfect. Thank you. Thank you, Jay. I don't know if anyone has any more questions. I've read all questions in the Q&A. I don't know, Jay, if you have any last remarks or anything.
No, I just think, I think it's an interesting area, and I think it's somewhere that, as you can see with the health behaviors and something that stress, I think, is connected to everything else that we do. And so if you're not managing your stress well, it probably says that there's some other areas where you need to work and think about in your life, because it's a challenge. And I think certainly the last year has made it more challenging. But, we'll all get through it. It's just, I think putting everything into perspective is probably the biggest thing you can do.
Perfect. Thank you so much, Jay, for this great talk. I personally benefited. I have so many notes out here, things I want to look into. Thank you to everyone that attended today. Hopefully we'll see everyone for next week. Next week will be same time, same place. It'll be Dr. Dana Tarah and Maryam Al-Hamid discussing healthy eating. Thank you, Jay. And we will now shift over to the QR codes. I think the guys, we're setting it up. So you can take out your cameras and take a picture of the QR code over here, which will guide you to sign up for next week's talk. Thanks to everyone, and thank you, Jay.